studies, like Dr. Schneider said, showing that our products can regulate key genes. Who's heard of GLP-1? Woo! Oh yeah, right? GLP-1's in the news a lot. What if I told you we have clinical data showing that our products, a few of our products, upregulate GLP-1? Would that be cool? Yeah. Vitality and Revive upregulate GLP-1. BDNF, who's heard of that? Brain-derived neurotrophic factor. Beautiful target, beautiful gene. What are genes made up of, by the way? Yeah, molecules. We're on the same page here. BDNF, great at supporting cognitive health. And our products regulate BDNF. NF-kappa B. Who knows NF-kappa B? Sweet gene, right? Talk about being a boss. NF-kappa B, when it comes to inflammation, it's one of these master regulators of supporting inflammation. Our products regulate NF-kappa B, PPAR alpha, SOD1, and others. And how many other companies show that their products regulate epigenetics? I haven't seen you. And why are we able to regulate epigenetics? It's the molecules. It's the curated approach. Sorry, we're just getting over and over again. They're like, will you stop now? It's about the molecules. But molecules are not beneficial if they're not absorbed, right? And that leads to the third pillar. The reason why we are cellular absorption experts is because we love molecules that much that we want them to get into the cell. We want all the molecules in all of our formulas to get into the cell. Now, when you think about it, there's a lot of molecules. You look at Vitalite, and there's like 40 some odd ingredients in Vitalite. But in each of those ingredients, there are many different molecules. So it's hard to know for sure, but when we run Vitalite through our instruments, they can detect molecules. And one peak represents a molecule. We have over 1,000 peaks. Vitalite has over 1,000 molecules. Isn't that crazy?
Crazy good.
Crazy good. Exactly. That is crazy good. Etranal, 800 molecules, 700, 600, 900 molecules in each of our products. So when you take our 6 products, which is our Proactive Wellness System, right? Because we really just have one product, a system that we broke up into 6 different delivery forms. So when you take our system, our Proactive Wellness System, you're taking thousands of molecules every single day. Is that going to have benefit to the body? Yeah. You bet it is. Is that going to counteract the molecular drain from our diet? Yeah. You bet it is. Is it going to help regulate epigenetics? Yeah. Absolutely. And so that's why we have our 11 different cellular absorption technologies. Now, why do we have 11? Why not just 1? Come on. 11? Why not just liposomes? Liposomes are cool, right? They're sweet. I love liposomes. Love me a good liposome. Why don't we just encapsulate everything in liposomes and be done? Molecules. Exactly. Exactly. Because some molecules are too big, they don't fit in liposomes. Some molecules are too small, they leak out of the liposomes. So if we really are serious about molecules getting into the cell, we need delivery technologies, some that help with big molecules, 1,000 molecular weights, some that help with small molecules of like 60, 70 molecular weights, and everything in between. So that's why we use absorption. And we have a really exciting announcement about absorption this weekend as well. So stay tuned for that. Yeah, it's going to be fun. Because we are always looking for new absorption techniques. When you discover a new molecule, a lot of times that new molecule means a new absorption technology, right? Makes sense. So it's all about the molecules. And I hope what I've shown you today is that our products, with our approach, and it's not just our products, but it's our approach. If you're using a different approach, then you get different results. And so our molecular approach that we're using gives different results. Doesn't it?
Yes.
Who feels a difference when they take our products? Have you tried our products before? Okay, that is the result of our molecular approach. When you try our products and you feel the power of our products, that means that our molecular approach, our system is working. So, in a nutshell, for medical professionals, that's what makes us different. There's no other company using this approach. Now, a molecular approach is actually a scientific approach. It's a pharmaceutical approach. Pharmaceutical companies, they're all about molecules as well. They're all about designing, synthesizing, discovering through synthesis. There are molecules, they put it through safety studies, ADMET, tox studies, they go into clinical studies, and they come up with this molecule that they sell. And they make $12 billion a year for that molecule, right? We're doing a similar approach, a molecular approach. We're discovering molecules. We're not synthesizing them in the lab. We're pulling them out and finding them in plants that have never been analyzed before. And pharmaceutical companies do absorption studies. Do we do absorption studies? We do. Pharmaceutical companies do safety studies. Do we do safety studies? We do. You can see those in our clinical studies. Pharmaceutical companies run clinical trials. We run clinical trials. As a supplement company, do you have to run clinical trials? No way. You know? And most companies don't want to. Why would you want to run a clinical study? I was consulting with a company a while ago, and I was telling them that they should really run a clinical. I didn't formulate the product. They had this set of products, and they wanted help scientifically to look at them. And I said, well, you should run clinical trials on it. And the CEO's like, I don't want to run clinical trials. I'm like, well, you really should. He's like, I don't want to. I'm like, you really should. He's like, I really don't want to. It's like, what in the world? And I was with dinner. I had dinner with him, like a week after this conversation. And he said, hey, I want to, because it's you and I want to talk about this. The reason why I don't want to run clinical trials is I don't think the results will be that good. Yeah, I'm just worried about the results, honestly, right? And as a supplement company, why would you want to run a clinical trial? Just let your marketing machine talk about things and go crazy, right? But we run clinical studies because we don't just want to hope it works or pray it works or think it works. We show unequivocally that our products work. So, with that, I'd like to take any questions. If you have a question,